Hi, my name's Carly. I'm 31 and I have stage 4, aka metastatic breast cancer. So, I wanted to share the lead up to me being diagnosed with stage 4 breast cancer because I think it's important to share. So, if anyone feels like any of this resonates with you, I mean, even if the exact symptoms and things don't align, but you feel something inside of you is calling or feeling uneasy about something, I just want to share this so you it doesn't instill fear in you, but it empowers you to be your own advocate. So back in 2020, right before the pandemic, I had noticed my right breast had grown exponentially. And so I went to the doctor and my gyno said, let's send you for a mammogram. They ended up doing a mammogram and ultrasound of both breasts as a baseline, and they had noticed fibroglandular density in my right breast, but didn't have an explanation as to why it had grown significantly in a short time span. So over the years, I never felt right about it, but I got the mammogram, I got the ultrasound, there was nothing to be concerned about. So in the fall of 2024, right before I was getting married, I was watching a TikTok of somebody doing self breast exam. And so I decided to do it myself. So I did the self breast exam and I felt something in my left breast actually. And I had still felt uneasy about my right breast. So I just decided to go to the gyno and point out the lump that I had found. And this is also something that I just want to express to people, when you're doing your self breast exam, please do it in different positions. Because when I was laying down, even when I was at my gynecologist, both myself and my gyno could not feel the lump in my left breast. We could only feel it when I was sitting up. So make sure you're doing it in multiple positions. So she had sent me for a mammogram and ultrasound of both breasts because of still the concern with my right. And they saw the island of fibroglandular tissue in my left breast that correlated with the lump. They also saw some asymmetry and some fibroglandular density in my right breast. So they said, let's do a biopsy of my left. And if that comes back benign, they would do a 6-month follow-up on my right. If only they had done, the biopsy of my left, my right. It might have been a different story, but they did the left breast and that came back benign. And so they said, we'll see you in 6 months. I got married. There was, it was a little bit of a whirlwind of a time. So by the time I got around to scheduling the mammogram in the spring of 2025, I got it done in June of 2025. So on June 3rd, 2025, I got my follow-up mammogram in my right breast, and I got a mammogram and ultrasound that day. And the radiologist actually came out to talk to me and asked why I had been coming so frequently to get mammograms, because for my age, at the time I was 30, it wasn't the norm. And I had explained, my concerns with my right breast dating back to 2020. And she said, it's just fibroglandular tissue. There are no areas of concern. It's not suspicious for malignancy. And she didn't expect to see me back until routine screenings in 10 years when I would be 40, which now feels, a little bit like a slap in the face, but that's a whole separate issue. So 3 weeks later, a little bit more than 3 weeks later, I woke up on June 27th, 2025 with back pain. And I had initially thought I slept wrong. So about a week and a half, I didn't recover still. My back was still really hurting me. So I scheduled an appointment with my primary. My primary called it a myofascial strain and prescribed me a steroid, 5-day course treatment, and muscle relaxers. I did the 5-day course. I initially thought I was feeling better, so I went back to try to work out. Before this, I was working about like 4 to 5 times a week, and so I tried to get back into working out. And immediately I went back to square one right before, I had started the steroids. So I decided, you know what, let me just take time off working out because I'm clearly not getting better. And I clearly just maybe did something when I was working out, and it's not that I just slept wrong. So I decided to take time off working out. I thought I was feeling better. So every time I would try to work out, right back at square one. So I called my primary back after, my husband and I had moved in August. And I after that I was down. Like it was bad. So she said, let's do physical therapy. At this time still I had no imaging done. I did physical therapy. At first I was getting really strong, and then I just took a nosedive. So that's when my physical therapist actually pointed out, I think you need to see a diagnostician, get imaging done, because this doesn't seem like it's purely muscular. Thank you to that physical therapist, by the way. I saw a spine specialist at Penn, and she ordered an x-ray. Nothing was seen on there, except that I have bilateral cervical ribs, which is an incidental finding. And she also ordered an MRI. This was on October 13th. I wasn't able to get an MRI until November 21st, which was very far away when I was feeling the pain that I was. So I said, I'm going to call every day, which was the advice of the scheduler, and try to get a cancellation. So I was calling every day, and in this time period, I was just quickly deteriorating. My back was getting worse and worse and worse. And one morning on October 23rd, that's when I woke up in excruciating pain.